Drug abuse during pregnancy is a serious concern and can have harmful effects on both the mother and the developing baby. The substances used, whether illicit drugs, prescription medications, or even alcohol and tobacco, can disrupt the pregnancy, leading to a range of health complications. Here's a breakdown of how drug abuse during pregnancy can affect both the mother and the baby. Risks to the mother. 1. Increased risk of complications. Drug abuse can increase the likelihood of complications such as high blood pressure, preeclampsia, and premature labor. 2. Health problems. Drug use can lead to other health issues for the mother, including infections, e.g., HIV, hepatitis, lung diseases, liver damage, and heart problems. 3. Mental health. Many drugs can affect mood and mental health, leading to depression, anxiety, or an increased risk of postnatal depression. 4. Difficulty with prenatal care. Women using drugs may be less likely to attend regular prenatal checkups or follow medical advice, which can affect the monitoring and health of both the mother and baby. Risks to the baby. Drug abuse during pregnancy can have serious consequences for the developing fetus, including 1. Miscarriage and stillbirth. 1. Drug abuse can increase the risk of miscarriage in the early stages of pregnancy and may contribute to stillbirth later on. 2. Premature birth. 1. Substance use, especially tobacco, alcohol, and illicit drugs, can increase the risk of preterm birth, which can result in complications such as low birth weight, respiratory issues, and developmental delays. 3. Low birth weight. 1. Babies born to mothers who abuse drugs are more likely to have a low birth weight, which increases the risk of health problems, such as difficulty breathing, infections, and feeding problems. 4. Neonatal abstinence syndrome, NAS. 1. Babies born to mothers who use drugs, especially opioids, may experience withdrawal symptoms after birth. 1. This is known as neonatal abstinence syndrome, NAS, and symptoms can include tremors, irritability, feeding difficulties, seizures, and low birth weight. 5. Birth defects. 1. Some drugs, like alcohol and certain prescription medications, can increase the risk of congenital disabilities, such as neural tube defects, spina bifida, or facial abnormalities like a cleft lip, palate. 6. Long-term developmental and behavioral issues. 1. Drug exposure in utero can affect the baby's brain development, leading to developmental delays, cognitive deficits, learning difficulties, and behavioral problems later in life. 1. These issues are especially common with alcohol and illicit drugs like cocaine. Types of drugs and their impact. Here's a look at how specific substances can affect pregnancy. 1. Alcohol. 1. Fetal alcohol spectrum disorders, FASD. Alcohol is one of the most harmful substances during pregnancy. 1. It can cause a range of developmental problems, known as fetal alcohol spectrum disorders, FASD. 1. These can include growth deficiencies, facial abnormalities, and long-term cognitive and behavioral impairments. 2. No safe amount. There is no known safe amount of alcohol during pregnancy. 2. Even moderate drinking can increase risks. 2. Tobacco, nicotine. 1. Smoking during pregnancy increases the risk of preterm birth, low birth weight, and stillbirth. 1. Nicotine and other chemicals in cigarettes restrict blood flow to the placenta, affecting the baby's growth and development. 2. Secondhand smoke. Exposure to secondhand smoke can also harm the baby's health, causing similar risks as direct smoking. 3. Prescription medications. 1. Opioids. Drugs like heroin, morphine, and prescription painkillers, e.g., oxycodone, hydrocodone, can cause neonatal withdrawal symptoms, NAS, and developmental delays. 1. Misuse of these medications can also increase the risk of miscarriage and preterm labor. 2. Benzodiazepines. Medications used for anxiety or insomnia, such as Valium or Xanax, can increase the risk of birth defects and may lead to withdrawal symptoms in the baby. 3. Antidepressants. Some antidepressants, especially SSRIs, are considered relatively safe during pregnancy, but others may increase the risk of complications like preterm birth or withdrawal symptoms in the baby. 3. Always consult a doctor before taking any medications during pregnancy. 4. Cocaine. 1. Cocaine use during pregnancy can lead to severe complications such as preterm labor, low birth weight, placental abruption, premature separation of the placenta, and developmental issues. 1. Babies exposed to cocaine may also have neurological issues and developmental delays. 5. Marijuana. 1. While some women use marijuana to combat nausea or sleep problems, marijuana use during pregnancy can affect the baby's brain development. 1. Babies born to mothers who use marijuana may have lower birth weights, developmental delays, and behavioral problems. 6. Methamphetamine. 1. Meth use during pregnancy can cause premature birth, low birth weight, and developmental issues. 1. It also increases the risk of the baby being born with withdrawal symptoms and neurological problems. Getting help. If a woman is struggling with drug abuse during pregnancy, it's important to seek help as early as possible. Many health providers offer support and treatment options tailored to pregnant women. Here are some steps that can be taken. 1. Talk to a healthcare provider. Consult with a doctor or obstetrician as soon as possible to develop a plan for reducing or quitting substance use safely during pregnancy. 2. Drug treatment programs. Many areas have specialized drug treatment programs for pregnant women, where they can get support for addiction while minimizing risks to the baby. 3. Support groups. Peer support groups can help women cope with addiction and connect with others who are going through similar challenges. Prevention and education. Education about the risks of drug abuse during pregnancy is crucial. Pregnant women and those planning pregnancy should be informed about the harmful effects substances can have on their babies and the importance of seeking medical advice if they are using drugs or alcohol. Conclusion: drug abuse during pregnancy is dangerous and can lead to serious consequences for both the mother and baby. The effects vary depending on the substance, but they can include miscarriage, preterm birth, birth defects, and long-term developmental problems. If a pregnant woman is struggling with substance abuse, seeking help and getting proper medical care is crucial to protect both her health and the health of her baby.